Welcome to our September Speaking of Health lecture series. My name is Eric Barsatan, and I'm the manager for Physician Relations and Medical Staff Services here at the Queen's Medical Center, West Oahu. Today, speaking of health, the topic is sleep during the COVID-19 pandemic, Coronasomnia syndrome. Right now and throughout the presentation, we could ask all of our viewers to be on mute. And if you have any questions, please type your questions in the chat box and our speaker will answer them as we go. So Dr. Blunt actually asked that our talk today to be interactive. So at any time you have any questions, please feel free to write those questions and Dr. Blunt can actually respond to them immediately. There are a lot of information going to be shared with you throughout the presentation. So again, ask those questions because we don't want to forget any of your questions. And at this time, I am honored and privileged to introduce our speaker, Dr. Danilo Blan. He is a pulmonary disease specialist at the Queen's Medical Center, West Oahu, with 30 years of experience in several areas, including sleep medicine and critical care medicine. Dr. Blan also specializes in the diagnosis and treatment of conditions that affect the lungs and respiratory tract. Other areas of interest include chronic obstructive pulmonary disease, which is also known as COPD, asthma and diseases of the respiratory system, shortness of breath, and sleep disorders. Dr. Blan received his Doctor of Medicine degree from the University of Santo Tomas, Faculty of Medicine and Surgery in Manila, Philippines. Dr. Blan received his internships, residency, and fellowships in the East Coast, in the state of New York, and New Jersey. Welcome, Dr. Blan. You may now proceed with your presentation.
Good afternoon. I'm Dr. Blan. Thank you for being with us today, discussing this very important topic. The pandemic has affected a lot of us. And today we'll talk about sleep during this pandemic. There's a new term called Coronasomnia. It's simple, but it's a very important term. See, Coronasomnia or the Coronasomnia phenomena had affected all of us, not only caregivers, not only patients, but practically everybody. This is the statistics of insomnia as well as sleep problems at the beginning of the pandemic. 24% of those affected by COVID-19 complained of insomnia. However, as we went through the pandemic, you can see now that 4 out of 10 people had been affected or had reported sleep problems during the pandemic. In fact, prior to the pandemic, 1/3 of Americans have not received enough sleep for the year. And in fact, the CDC had called it the public health epidemic. So we already have this epidemic, and then coronavirus came in, and you can see that almost 4 out of 10 people have been affected. And the onset of COVID-19 had worsened the situation. So what happens if we don't have adequate sleep? Studies have shown that if you don't get enough sleep, you have problems, weakened immunity, high blood pressure, weight gain, diabetes, memory problems, and a lot of cardiovascular as well as metabolic, even neurologic deficits had been seen. So let me just go to this very complicated picture, but you can see that in this cartoon, the virus enters the body through the nose. So you can follow this. It follows through the nose, and then it penetrates the area of the brain. This is the coronavirus virus that will go into the what you call the blood-brain barrier. So if you remember, the first symptoms that had been observed was the problems with smell. It's because the virus enters the body through the nose, and it can go through the brain through what we call the blood barrier, cribriform plate, and this has affected the brain. It makes it swollen, and this triggers a cascade of problems. So let me mention about symptoms happen even during that time that the patient is infected with the virus. That could be circulatory symptoms that amounts to depression, anxiety, trauma, and it can cause fatigue, anxiety, depression, and then the insomnia, which we'll be discussing some more in detail. And we have mentioned about the effects of the COVID-19 virus, even during hospitalization and after. What are these? It could cause confusion, delirium, impaired consciousness, encephalitis, seizure, and stroke. Now, after the discharge from the hospital or after the ICU discharge, they can have these executive syndromes. What are these? Inattention, disorientation, difficulties of organizing response to command, and higher risk of dementia. So now, who are those who are affected by this coronasomnia? 74.9% for younger adults. And would you believe, unpaid caregivers, essential workers? We are all essential workers. We are all frontline workers, and the racial and ethnic minorities. So you can see that across the board, all of us are affected by this syndrome. So what happens? What happens if you don't get good sleep? Now, if you remember or if you have read that for adults, we need at least 6 to 7 hours of good sleep, quality sleep. And if you don't have this good quality of sleep, you have problems. And this has been the result of home confinement, lifestyle disruption, circadian misalignment, daylight exposure is not there, emotion dysregulation, and stress and anxiety. Now, for us here in the hospital, we have a lot of problems when we have this rhythm misalignment, circadian misalignment, problems with shift work. And all of us here, especially caregivers, have problems and will result to poor sleep. Now, why is this happening? Well, because people are not leaving their homes because of the fear of COVID. We're not going to work as we once did. Not getting that daily exposure of sunlight in the morning. Now, the blue light from your iPad, from your iPhone, smartphone, disrupts the circadian rhythm. You know, the blue light is like a stimulus in the brain. The brain usually detects that blue light as if it is sunlight. So if you open your iPhone or your cell phone or your iPad at night, the brain will say, aha, it's already daytime. And then you have this shift of your circadian rhythm. And I call this the jet lag in slow motion. So sleep-wake pattern can quickly erode if people are spending their days indoors, socially and physically isolated. Just like now, participating in video meetings, too much exposure to blue light from electronics, social media, news, disruption of circadian rhythm has affected our sleep pattern. Now, this can result to abnormal dreams, disruptive nightmares, and other types of sleep disturbance triggered by the pandemic, which has profound impact on the psychological, mental well-being of individuals across society. Now, again, loss of sleep not only affects the mood and attention, but the body's ability to fight infection by boosting the immune system. You see, a good sleep will boost our immune system. Do you know that part of an experiment that was done before was those who sleep more than at least 6 or 7 hours will get less flu or flu symptoms versus those who sleep only about 3 to 4 hours. So a good sleep, I call it the refreshing sleep, will also boost your immune system and prevent infection or even viral infections. So when we sleep, the body recovers from the day working to repair muscles, organs, and cells. This is the most important part of this slide because hormones are regulated. Hormones are linked to the circadian rhythm. So if you disturb that rhythm, hormones are all over the place. Take, for example, growth hormones. Growth hormone is linked to slow wave sleep, meaning growth hormone will come up if your sleep has good quality. That's why we ask our kids, go to sleep so that you will be able to reach 6 feet or say 6 foot 1 feet, because growth hormone is linked to the sleep. So if you have a disruption of sleep, hormones are all disrupted. Not only growth hormones, prolactin, estrogen, progesterone, and a lot of the hormones are linked to sleep. Plus, the brain stores information and prepares us mentally for the next day. Again, as I mentioned, sleep boosts the innate and acquired immune response, and this is significant. Now, what happens? What happens? What have been happening during this COVID-19? As I've said, there have been increase in sleep problems, anxiety, depression, stress, and this is different from the traditional insomnia because this is now related to the COVID-19 pandemic. Why? Well, because our fears of getting the virus, concerned about our loved ones, not being able to work, less social contact. Our lives have been turned upside down by fear and isolation. Now, this is what I call fed up. This has brought up financial stress, emotional stress, distance from others, unpredictability, and professional concerns. Now, insomnia is when we have this difficulty of initiating and maintaining sleep because of this increased stress level, increased anxiety, depression. Sometimes we have this delayed sleep schedule. We cannot sleep on our usual time. So we sleep at around 1 or 2 a.m. And there's this sleep deprivation will result to excessive daytime sleepiness. We have impaired concentration, poor mood. Now, who develops this coronasomnia? As I said, all of us are vulnerable. Anyone can develop symptoms, but certain groups of people have increased risk. Of course, patients with COVID-19, frontline workers, unpaid caregivers, essential workers, young adults, and students. You see, I have noticed that even students, they already have this what we call delayed phase of sleep pattern, meaning they go to sleep later and later. And because of this COVID-19, they have been worsened by this stress, and more of the students are now having this delayed pattern more and more. So when they go back to school, you wake them up, we wake them up at 7, but they went to bed at 3, so they only had 4 hours of sleep. So they have these problems, especially when the school resumes.
Dr. Ablan?
Yes.
We have a couple of questions actually from our viewers. The first
Okay, thank
question
you.
is,
Yes.
how safe is it to use melatonin? Sometimes you use it
Okay.
once or twice a month. Does it leave any bad side effects?
I'd like to answer that later. However, now is the time to answer it. Melatonin is the dark hormone, meaning when it's dark, when we go to sleep, we secrete our own melatonin. So usually our melatonin are secreted between 8 p.m. up to 9 p.m. and this induces sleep. Okay, so the pineal gland inside our brain have its own melatonin. So if we want to induce sleep, we should not compete with our own melatonin. Meaning if you take melatonin at the same time as you are producing your melatonin, it will not go. We use melatonin for rhythm. Remember, we talk about rhythm disturbance, circadian rhythm. It's relatively safe. It's over the counter. It's available. However, please discuss with your physician about using the melatonin. Now, if melatonin is prescribed, it should be taken early so that you don't compete with your own melatonin level. So I always tell my patient, what time do you go to sleep? 10. You should take melatonin around 2 hours before 10 o'clock so that it will build up. It will build up the melatonin, and your own melatonin will now complement your melatonin level. So I hope I will answer this question some more when we go to management. So,
And Dr. Ablan, there's actually one more question. I know you wanted that
yes,
question up
please.
front.
Yes.
Yeah, the other one is regarding blue light. The fact that everybody, on social media, using their phone as well as their computers at night. So you talk about blue light. Is there anything that they can do to prevent their eyes being exposed to blue light when using these electronics? Are there glasses? And how would you know
Well,
if the glasses that you're purchasing is of quality?
yes, of course, the best thing is not to use it, Eric, because the blue light itself is the brain is so sensitive to the blue light, and it has the same wavelength as a sunlight. So if you really want to have light, it has to be, your light should not be straight into your face. It should be at the background if you really need to have light. So what I'm trying to say is, if you wake up at night and you let's say 2 a.m. and you open up your cell phone or your iPad or your computer, what it means is the brain has detected that the sunlight is there, because sunlight is the best sight giver, they call it. This is it's the factor that will set your rhythm. See, I always talk about rhythm, because this is the best way to take care of this problem. You have to reset your rhythm, and we will talk about it later on, because if you reset your rhythm, just like if you reset your time during jet lag, eventually your body will catch up. So going back to the question, of course, the best thing is not to use it, but if you need to use light, it has to be at the back so that it will not be straight to your retina, because that's when it goes to the brain, and then the brain detects that it's already daytime and you wake up, or you're forced to wake up. And since the body is still in a sleeping pattern, then you cannot even go back to sleep anymore. So I hope that answers your question, Eric.
Thank you.
So how about those patients that have had COVID-19? They said, one patient says, it has been 7 months since I contracted COVID-19, still scared. He will get short of breath and when he goes to sleep. And these symptoms are gone, but the night still comes with terror. So this is now a symptoms of the long haul syndrome. Almost half of patients recovering for COVID-19 reported difficulty in sleeping as one of the lingering symptoms. In fact, researchers likened the psychological impact to PTSD, but with a different symptom. So again, even before the COVID set in, those patients that are in the hospital will still have a potential problem after they are discharged. Now, this is, I guess, the meat of this talk is, what should we do? What should we do to take care of this problem? So some of this slide will be redundant, but I will be emphasizing all of this. Establish a bedtime and morning routine, okay? Prepare the morning as if you are going to work. So if you're doing your work at home, you're doing your computer and you wake up at 11 a.m., go back to sleep at 3 p.m., then you don't have that rhythm. You should wake up at the same time, have breakfast at the same time, have dinner at the same time. So you are now trying to establish your rhythm. Again, wake up at the same time, dress up as if you are going to work so that you will establish your regular rhythm. Exercise. You don't have to go to the gym. Of course, it's closed, but that 5-minute to 10-minute exercise should be important, even if it's not complete, so that, again, you try to develop that rhythm. Limit caffeine and alcohol. Okay, caffeine has a 6 hours of half-life. So the last cup of coffee should be around 3 p.m. or 2 p.m. How about alcohol? Alcohol is metabolized quickly in an hour or two. Some patients will take alcohol to induce sleep. Yes, they induce sleep, but since it's metabolized so quickly, believe me, they will wake up about 2 a.m. or 2 or 3 a.m. and they're tired at night. And they're tired in the morning. They're tired daytime. Why? Because alcohol induces sleep but does not allow you to go to the deeper part of sleep, which we call the slow wave of sleep or stage 3 sleep. So if you need to take your wine for dinner, do it early. Do it early, about 7 or 8 p.m., so that by 10 p.m. it's already dissipated and there's no effect of the alcohol. Avoid long naps, meaning if you need to take a nap, 15 to 30 minutes is a maximum, so that, again, you don't disturb your rhythm. No heavy meals before bedtime. 3 hours before bedtime is the last meal, 3 hours of the bedtime. Now, ensure the bedroom and space of sleep. It is dark, quiet, and cool. So 75, 74 degree should be the optimum temperature. As I've said, set boundaries of blue light exposure. Give yourself a break from the news. Relieve stress, yoga. Get a good sleep at night after vaccination. Okay, so this is, again, you vaccinate, you go have a good night's sleep. Again, this will even potentiate the immunity, the immune response that your body on the vaccination. So I'm sorry for this slide, but these are the different tips that I could give to you. Again, establish a regular time and waking time. Allow yourself to take a nap if you're tired, but again, limit to about 15 to 30 minutes. Adjust to a healthier lifestyle regarding substance use. Again, alcohol should be taken. If you need to have a dinner, take it early. Cutoff time for caffeine is 3 p.m. Change your bed nut snack. Watch out your workout routine. Use comfortable, inviting beddings. Temperature 72. Block out all distracting noise and eliminate light as possible. And then your bed should be only for sleep. Don't use your bed as your office. Don't use your bed as a recreational place. Your bed is only for sleeping and for intimacy. Now, again, I've been repeating this. Hydration, diet, exercise, cognitive stimulation while you're at home. You can reconnect with your family through the phone. Make sure that you're not isolated. Rest and relaxation, stress management. Keep a happy bearing, joy, purpose, and meaning, and it's time to heal. Again, I had mentioned no coffee after 2 or 3 p.m. Create a relaxing ritual before bedtime. Turn off the TV. Block the blue light. This is blue light again. Okay, take a hot bath before bedtime with Epsom salt. You can buy that anywhere. Lavender essential oil. Use your bedroom only for sleeping and intimacy, I have mentioned earlier. Now, here comes now the medications. How about medications? Yes, there are Z drugs like zolpidem and acipiclone or other benzodiazepines. But you have to discuss this with your doctor because these should only be limited to 2 weeks if possible. Why? Because, as I've said earlier, these substance-inducing sleep will only give you a sleep that's not the what we call good sleep or restful sleep, which is the slow wave sleep or the stage 3 sleep. Okay, sleep is in 4 stages: stage 1, 2, 3, and REM. REM is when we dream. Stage 3 is the restful sleep. This is the stage 3 when your body relaxes. It's stage 2 is in between, and it's stage 1 is just when the phone rings, you can still wake up and answer the phone. This sleep-inducing medicines will only allow you to go to stage 2. That's why you may sleep, but you don't have that restful sleep. Now, let's go back to melatonin. As I've said, melatonin is a natural hormone coming from the pineal gland. And this, we use it to reset our circadian rhythm. Rhythm again. So if you need to take your melatonin, it has to be 2 hours before bedtime. And we sometimes use this for jet lag. We sometimes use this to reset the rhythm, especially for shift work patients. But again, it's nice, even if it's over the counter, we should discuss this with our doctors. So I hope with all this sleep techniques, I was able to answer some of your questions. And if there are any other questions, Eric, please allow our listeners and participants to ask for more questions, Eric.
Yes. Again, for viewers, if you can, if you have any questions, please feel free to put those now in the chat box. Dr. Blan, one of the questions that came up is regarding, I know there's a mention of caffeine and alcohol to limit those. You said, how about sugar? Does sugar affect your sleep?
Well, I know some patients mentioned about sugar rush. I think it's because of the metabolism of sugar. I'm not really sure about this direct relationship of sugar and sleep, but it's because of the metabolism itself. So when you take sugar, you you transform that to calories. Uh, Actually, approximately 9 calories per gram of sugar, and it's possible that when you metabolize something, heat also develops, and that may affect your sleep. Okay, when we go to sleep, we actually our temperature drops. That's why it says you cool down during sleep. You cool down during sleep. So if you notice around 2, 3, or about 4 or 5 p.m., you start to sweat a bit because the body is following the rhythm again. Your temperature goes up. So you warm up when you wake up. Okay, so cool down when you sleep and you warm up when you wake up. Why? Because that's the rhythm, that's the temperature, that's what the brain is telling us to do. So if you disturb this rhythm again, you may not be able to sleep. So going back to your question, I postulate that if you get enough calorie to be metabolized and you produce heat, then instead of cooling down, the temperature still stays the same or a little bit goes higher. That I would explain how sugar would affect the sleep, Eric.
I see. Another question that we have here is now that people are traveling, this one person said that they always have a jet lag when they travel because of time difference. What can they do to have a good sleep once they reach the destination?
Okay. Yes, that's the problems with travel. So let's say you are you are going to the East Coast. So the East Coast is around 6 hours ahead of us. So you try to simulate the time of sleep with the East Coast. So because it will take some time for you to adjust when you reach your destination. So if possible, go to sleep earlier and earlier. I'm sure you will be able to adjust a little bit better when you reach the East Coast. And then the opposite is when you go from east to west, is then you have to delay a bit your sleeping time because you are now delaying it. So another thing is the moment you reach your destination, instead of sleeping, no, you 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 follow as if you are there already for the past 3 or 4 days, so that your rhythm again will adjust. Some sleep specialists will give you melatonin to adjust your rhythm, especially with jet lag syndrome. So uh, that's what we do. So East Coast travel, you go to sleep earlier. West Coast travel, you go to sleep a little bit later, Eric.
Very good. Another question that we have here states that they love their alcohol and coffee, so they cannot get rid of it. But they said, is there a specific time, or what is the latest they should be taking those alcohol or coffee so they would have a better sleep?
Okay. So as I've said, alcohol alcohol is metabolized very quickly. Some say that they take alcohol to induce sleep. Yes, they can sleep, but I've said you will not reach stage 3 sleep. You will only reach about stage 2, which is not restful. Now, let's say you take your last alcohol at around 11. By the time you reach about 2 a.m., alcohol is gone. You wake up, but the body says you have to sleep. So there's this conflict now. So the moment you wake up at 7 a.m., you're tired. Now, again, if you have to take alcohol or wine, it has to be early, like 7 or 8, so that by the time you reach about 11, that has been metabolized and you can still follow your own sleep pattern. Now, caffeine, it takes about 6 hours for it to dissipate. That's why I've said the last coffee should be around 2 or 3 p.m. so that by the time are about to go to sleep at 10, the effect of coffee is not there anymore. So 6 hours is the time to metabolize your coffee. So please, if you really want to have a good sleep, last coffee time it should be about 2 or 3 p.m. So that's I hope that clears up a bit about this question of coffee and wine or alcohol, Eric.
Very good. Another question here is regarding sleep studies. Do they just come to you, or do they have to be referred by their primary care physician?
Yes, we are a subspecialty clinic in our sleep lab. We do sleep testing. We do for obstructive sleep apnea. Also, we do different kind of sleep problems, circadian rhythm, insomnia. So we coordinate with your primary care physicians, Eric. So please, we prefer that they get in touch with your primary care and be referred to our clinic, Eric.
I see. Very good. I have one more question here. And so what is your recommendation if your partner or spouse snores at night and you're having difficulty sleeping? What is your advice for those couples that have those sleeping issues?
Yes, I'd like to touch on that sleep apnea too, that patients who have sleep apnea, established sleep apnea, should wear their CPAP even during this pandemic. Anyway, snoring is one of the symptoms of sleep apnea. What happened is the airway becomes rubbery. That's why we snore. So when we snore, that's the next thing that happened is you have a negative pressure that inhales. You inhale and the airway closes, and that's what you call sleep apnea. Snoring, as long as there's no apnea, is cosmetic, meaning as long as there's no, we call it habitual snoring. It may just be a cosmetic symptom, meaning it really does not impact on our health. It's the apneic episode, the episode that follows the snoring, that is the problem. So if your spouse snores, check if he or she stops breathing. Let's say snoring and then silence. When there's silence, that means they're not breathing. It takes only 4 seconds for the oxygen to drop. And if no oxygen to the brain, it can affect sleep. It can cause hypersomnia or insomnia. So for those spouses who have mentioned about snoring, make sure that they don't have this apneic episode, meaning no flow, no breathing. And that is a medical issue that needs to be taken care of. And discuss this with your doctor, and they can be referred to our sleep lab or sleep problems, Eric.
Thank you. Actually, more questions came up. This is regarding naps. This person mentioned that it's hard for them to nap only 15, no more than 30 minutes. What would be the problem if they take, because they said they normally take about an hour nap. Is that good or bad?
Okay, so we sleep. What is the best number of hours for sleeping? Optimum is about 7 to 8 hours. The Sleep Society said 7 hours is good for adults. So let's say your body needs 7 hours of sleep. Now, if you take an hour away from that, let's say you sleep after lunch for 2 hours, that means the body only needs about 5 hours now. So you again disturb your circadian rhythm. See, it's all rhythm. It's like spending $2 when you're only allowed to spend $7 for the night. You already spent $2 after lunch. So you only need 5 hours. That's why when you take a nap and you go to sleep, you cannot sleep because you only are allowed 5 hours. Now, the circadian rhythm is not affected if the nap is about 15 to 30 minutes. So please, again, if you need to take a nap, limit to about 15 to 30 minutes. I know, like, it's maybe cultural. I know in Spain they do siesta. They go to sleep after lunch, 2 hours. But again, physiologically, your rhythm is disturbed if you sleep in between. So we need to have that compact sleep. You have to have a stage 3 or slow wave sleep that should be spent from the time you go to bed and from the time you wake up. So I hope that could explain this napping as well as the need to have a compact and adequate quality of sleep, especially with this ongoing pandemic, Eric.
Another question here says, I have heard that the brain will force sleep after lengthy periods of insomnia. Is that true? And if so, how long does that take?
Can you repeat? Can you repeat, Eric?
I'm sorry. It says, I have heard that the brain will force sleep after lengthy periods of insomnia. Is that true? And if so, how long does that take? So if you have a long period of insomnia, will the brain force you to go to sleep?
Yes, the brain will eventually catch up. However, you cannot force the body to sleep without any aid, but you can force your body to wake up. So what I'm trying to say is, it's the rhythm again. It's the rhythm that will be readjusted. So wake up at the same time. Wake up at the same time, even if you did not sleep well the day or the night before. Because eventually, this is the answer to your question, eventually the body will not say, I have not slept, so eventually you now be able to sleep and catch up. But even if you only slept about 3 or 4 hours the night before, you wake up again at the same time to reset the rhythm. And that's the only way to do it. And then when you wake up, you have to have sunlight as your sight giver or your time giver. And then have sunlight again in the afternoon or the evening, because the sunlight is the one that makes the sleep compact. So those patients that had insomnia, eventually they will catch up because the body needs to sleep. The body needs to sleep. So now, for how long? It depends on that cycle that eventually dictate that you need to sleep. Now, if you want really to take care of the problem, the only thing that you can control is the wake up time. Wake up at the same time. I've been discussing the whole time. Wake up at the same time. Even if it's a weekend, if possible, wake up at the same time, Eric.
Okay. Another question here is related to exercise. They said this person likes to exercise before they go to sleep, and look like they do, hard exercises here. Is that dangerous?
Okay, there had been studies about exercise as well as stimulating your hormones during exercise, but this had been disproven. Really, if you need to exercise, this is what I tell my patients. Exercise, vigorous exercise, probably a few hours before sleep, not just before. Exercise for yoga and strengthening, so stretching should be done prior to sleep. But vigorous exercise about 2 to 3 hours before sleep should not affect your sleep, should not affect your hormones. In fact, this has been some studies saying that before we used to say don't do vigorous exercise before sleep, but I would say 2 to 3 hours before bedtime, that should not affect your sleep. But if you really need to exercise just before sleep, yoga, stretching should be the best way to exercise before sleep, Eric.
Very good. And that was the last question that I received, and look like that's it. So again, I would like to thank once again our speaker, Dr. Danilo Ablan, here at the Queen's Medical Center West Oahu, and of course to all of you, our virtual audience. And so that concludes our State of Health presentation for September. At this time, we'd like to ask all of you to please complete the evaluation. So right now, Dr. Ablan, if you can go to the next slide. Yeah, so the information is on your screen. So you can actually scan the QR code from your phone to do the survey. And you can also click on the link of the survey on the chat box. Again, it should be very quick, should take a few seconds. So let's give you a few moments to complete your evaluation. And as always, we'd love to hear your feedback and comments. Yeah, so I'm going to be giving you a few moments to do that. And please make sure you don't log out after you complete your evaluation. All right. Hopefully everybody's done. Again, the Queen's Medical Oahu Virtual Speaking of Health Series, the third Thursday of each month, same time, 12:30 to 1:30 p.m. Tune in for the next lecture, which will be coming to you on Thursday, October 21st. And our speaker will be our new cardiologist, Randolph Hutter, who will be talking about chest pain and coronary artery disease. It's another excellent topic, and we know that some of you asked for such topic based on your feedback in the past, and that's the reason why those evaluations are very important to us. Look out for the announcement, which will include registration information. We hope to see you then, and feel free to share or forward the announcement to your friends, family, colleagues, and anyone you may think be interested. On behalf of our COO and Senior Vice President Susan Murray, our Chief Medical Officer Dr. Ronald Kuroda, and the entire Queen Medical Center West Oahu Ohana, mahalo nui loa. Thank you very much for joining us today. Until next time, please take care and always be safe. Aloha.